As the Affordable Care Act continues to expand the number of Americans who are covered by health insurance, undocumented immigrants have largely been left out. But recent legislative measures in California may expand insurance options for the state's undocumented residents, and they may inspire policy changes in other states as well. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Rachel Fabi, a Ph.D. candidate in bioethics and health policy at the Johns Hopkins Bloomberg School of Public Health. Ms. Fabi has co-authored a perspective article about efforts to cover undocumented immigrants in California. Ms. Fabi, you write in your article that the Affordable Care Act continued a long-standing restriction on the use of federal funds to insure undocumented immigrants. So, in the run-up to that legislation, was there ever an effort to expand coverage, or was it always considered too controversial?
To expand coverage to undocumented immigrants prior to the Affordable Care Act? No, there really hasn't been very much movement on this front. With the exception of expanding care to pregnant undocumented immigrants, where there has been some movement both at the state and federal level, actually since the George W. Bush administration. But otherwise, no, not a whole lot of movement on the federal front.
So in California, the first policy you mentioned, which the state passed in 2015, involves using state funds to offer coverage to undocumented immigrant children. Given that, what nonetheless are the barriers to reaching those children and their families?
That's a great question, Steve. There are a lot of barriers to reaching these children. One might be what we call the chilling effect, which is the idea that undocumented parents might fear that enrolling their children in this health insurance could put them at risk of deportation. Other barriers could be just a lack of knowledge about these policies. There are communication efforts underway in California in Spanish language and others to make people aware that this is now an option for undocumented children. But those efforts are going to have to continue because since May, only approximately 135,000 children have enrolled. And while that's a huge improvement over no undocumented children enrolled in health insurance, the thought is that the eligible number is actually quite higher, and this chilling effect is preventing people from enrolling their children.
So another policy, which the state passed in June, would allow undocumented immigrants, adults as well as children, to purchase health plans through California's insurance exchange. How much of a difference do you expect that policy to make, given that those undocumented immigrants can't receive subsidies for that coverage?
Yeah, that's a great question, too. So we do think that this policy is going to be largely symbolic and not have too much of an effect, given that undocumented immigrants are ineligible for these federal subsidies. That said, there are some possible effects that this policy could have, one of them being to improve the condition of mixed-status families, where you might have undocumented parents and citizen children. Allowing undocumented adults to purchase health plans through the same portal as their children might reduce that chilling effect that I talked about earlier and make it easier for whole families to become covered.
And then a third policy that was proposed in the last legislative session would create a program similar to Medicaid for undocumented immigrant adults. What are the chances that a bill such as that would succeed in a future session of the legislature, and what are the chances that it would be fully funded as well?
I can't really comment on its odds going forward because every legislature is different, and we're recording this prior to the November election, but I know that this will be aired afterwards. So in California especially, there are state senators up for election, and they could very well change the composition of the California state legislature. That said, there is a lot of political will in California behind this sort of policy, given the large undocumented population. So I really can't predict at this point how much success it would be likely to have. As far as being funded, as we mentioned in the paper, it wouldn't be an entitlement program in that the funds aren't guaranteed. It would have to be funded through the state budget every year. And so again, it would be highly dependent on the makeup of the legislature.
California has been the first in the country to go down this road. Have there, though, been efforts in other states to expand insurance coverage for undocumented immigrants?
Well, California is the first to propose allowing undocumented immigrants to purchase insurance on their state exchange. They're actually not the first to allow undocumented children to enroll in Medicaid. New York, Illinois, and Massachusetts have all done this in the past and continue to do so. As far as expanding a Medicaid lookalike for adults, no, there's not a whole lot of action on the state level anywhere else in the country. Most of this action is actually on the local and city, county level. We see in New York City, they recently began a pilot of what they're calling the Direct Access Program, which provides health care, not health insurance, but reduced cost or free health care to undocumented immigrants. And here in Baltimore, we have a program called the Access Partnership, which provides very similar services to the New York Access Program to any undocumented immigrants who live within a certain number of zip codes near the Johns Hopkins Hospital.
Finally, have California and other states made any efforts to improve access to healthcare services for undocumented immigrants, including people who aren't covered by insurance?
No, I'm not familiar with anything that the state has done. There are, I mentioned the New York program and the Baltimore program. There are similar city-level programs to expand access to services. For instance, there's the My Health LA program, where, according to their website, of the 400,000 uninsured people living in Los Angeles County, 280,000 are served through the My Health LA program. So, again, I think a lot of the action has been on the city level rather than the state level. So what we see in California is actually going to be a very interesting test case going forward of the political feasibility of legislation that could be replicated in other states should they prove successful at increasing insurance rates and reducing costs.
Thank you, Ms. Fabi.